Hair loss. It's something many people experience at some point in their lives. It can be a natural part of aging, just like wrinkles or age spots. But hair loss can also be triggered by various factors, from genetics to medical conditions. We often associate thick, luscious hair with youth and vitality. So, it's understandable that losing it can be emotionally distressing. It can impact our self-esteem and even lead to anxiety and social withdrawal. But here's the good news. Hair loss isn't always permanent. Understanding its causes and the available treatments can empower you to address the issue and explore potential solutions. Remember, you're not alone in this journey. Millions worldwide experience hair loss, and there's a wealth of information, support, and treatment options available to help you manage it effectively. Our hair is often seen as a reflection of our identity. It frames our face, contributes to our overall appearance, and can even influence how others perceive us. This is especially true in cultures that place a high value on thick, vibrant hair. For many, a full head of hair is associated with attractiveness, youthfulness, and good health. Conversely, hair loss can trigger feelings of self-consciousness, impacting self-esteem and confidence. It's important to remember that beauty is subjective and comes in all forms. Your worth and value extend far beyond your physical appearance, including your hair. To understand hair loss, it's helpful to understand how hair grows in the first place. Each strand of hair on your head grows from a tiny opening called a follicle. These follicles are located beneath your skin's surface. At the base of each follicle is the hair bulb, where cells divide and multiply to form the hair shaft, the part of the hair we see. Hair growth happens in cycles, with periods of active growth followed by resting phases. During the resting phase, old hair sheds, making way for new hair to grow in its place. Hair loss occurs when this natural cycle is disrupted, leading to excessive shedding or a slowdown in hair growth.
Hair loss isn't always as simple as it seems. Multiple factors can contribute to it, and understanding the root cause is crucial for effective treatment. One of the most common culprits is genetics. Androgenetic alopecia, also known as male or female pattern baldness, is hereditary and affects millions worldwide.
Hormonal imbalances can also play a significant role. Conditions like thyroid disorders, pregnancy, and menopause can disrupt the hair growth cycle, leading to excessive shedding.
Nutritional deficiencies, particularly in iron, vitamin D, and biotin, can also contribute to hair loss. Our hair needs a steady supply of essential nutrients to grow and thrive.
By identifying these root causes, you can better tailor your approach to managing hair loss and work towards healthier hair growth. Section 5, Common Types of Hair Loss, Patterns and Conditions. Hair loss isn't a one-size-fits-all condition. It manifests in various ways, each with its own set of characteristics and underlying causes. Androgenetic alopecia is the most prevalent type, affecting both men and women. In men, it typically presents as a receding hairline and thinning at the crown, while women may experience a widening part and overall thinning. This type of hair loss is often hereditary and can start as early as one's 20s, gradually progressing over time. Telogen effluvium is another common type, often triggered by stress, illness, or medications. It causes hair to shift from the growth phase to the shedding phase, leading to noticeable hair loss. This condition can be temporary, with hair regrowth occurring once the underlying cause is addressed. However, it can be distressing and may require medical intervention to manage effectively. Alopecia areata is an autoimmune disorder where the body's immune system mistakenly attacks hair follicles, resulting in patchy hair loss on the scalp and other body parts. This condition can be unpredictable, with hair regrowth occurring spontaneously in some cases, while others may experience chronic hair loss. Treatments can include topical immunotherapy and corticosteroids to help manage the symptoms. Understanding the specific type of hair loss you're experiencing is key to determining the most appropriate treatment approach. Consulting with a healthcare professional can provide a tailored plan that addresses your unique condition, helping to restore not just your hair but also your confidence and well-being. Section 6, Fighting Back. Prevention and Early Action. While not all types of hair loss are preventable, there are several proactive steps you can take to promote healthy hair growth and minimize excessive shedding. Incorporating these habits into your daily routine can make a significant difference over time.
Maintaining a balanced diet rich in fruits, vegetables, lean proteins, and healthy fats is crucial for providing your hair with the essential nutrients it needs. Foods like salmon, avocado, and leafy greens are particularly beneficial for hair health.
Managing stress through techniques like exercise, meditation, and spending time in nature can help regulate hormone levels and reduce stress-induced hair loss. Activities such as yoga, jogging, and mindful meditation are excellent ways to keep stress at bay.
Gentle hair care practices, such as using a soft brush, avoiding tight hairstyles, and limiting heat styling, can prevent breakage and minimize damage to the hair shaft. Opt for low heat settings on hair dryers and avoid excessive use of flat irons and curling wands. If you notice unusual hair loss, it's essential to address it sooner rather than later. Early detection can make a significant difference in treatment effectiveness. Early intervention can often slow down or even reverse hair loss, leading to more successful outcomes. Consulting a healthcare professional at the first signs of hair thinning can provide you with tailored advice and treatment options. Section 7, treatments for hair loss, from medications to procedures. Depending on the cause and severity of your hair loss, various treatment options are available ranging from medications to surgical procedures. These treatments can be tailored to meet individual needs, ensuring that each person receives the most effective care possible. Medications like minoxidil, also known as Rogaine, and finasteride, known as Propecia, are commonly prescribed for androgenetic alopecia. These medications have been extensively studied and have shown significant results in many patients. Minoxidil is a topical solution that stimulates hair growth by widening blood vessels and increasing blood flow to hair follicles, while finasteride is a pill that blocks the production of a hormone called DHT, which contributes to hair loss in men. Both treatments require consistent use over several months to see noticeable improvements.
Hair transplantation surgery is another option for those seeking a more permanent solution. This procedure involves transplanting hair follicles from one part of the body, usually the back or sides of the scalp, to the balding or thinning areas. The results can be very natural-looking and long-lasting. Platelet-rich plasma, or PRP therapy, is a newer treatment that involves injecting concentrated platelets from the patient's blood into the scalp to stimulate hair growth. This method leverages the body's natural healing processes and has shown promising results in early studies.
It's crucial to consult with a qualified healthcare professional to determine the most suitable treatment plan for your specific needs and medical history. A thorough evaluation can help identify the underlying causes of hair loss and guide you towards the most effective and personalized treatment options available. Section 8. Natural remedies, exploring alternative approaches. In addition to conventional medical treatments, many natural remedies are touted for their potential hair loss benefits. While scientific evidence to support their effectiveness is often limited, some individuals find them helpful in conjunction with other therapies. Essential oils like rosemary oil, peppermint oil, and lavender oil are believed to stimulate hair growth when massaged into the scalp. Saw palmetto is a herbal supplement that may block the conversion of testosterone to dihydrotestosterone, or DHT, a hormone linked to hair loss in men. Biotin, a B vitamin, is essential for hair growth and often included in hair, skin, and nail supplements. Remember that natural remedies can interact with certain medications, so it's crucial to consult with your doctor before incorporating them into your routine. Section 9. Seeking expert help, when to see a doctor. While experiencing some hair loss is normal, certain signs warrant a visit to a healthcare professional. If you notice sudden or patchy hair loss, rapid thinning, or hair loss accompanied by itching, burning, or redness, it's essential to consult a dermatologist or trichologist, a hair and scalp specialist. These symptoms could indicate an underlying medical condition that requires prompt diagnosis and treatment. Additionally, if you're concerned about the emotional impact of hair loss, don't hesitate to seek support from a therapist or counselor. They can provide coping mechanisms and help you navigate the emotional challenges associated with hair loss. Section 10. Your hair loss journey, finding the right path. Remember that there's no one-size-fits-all solution to hair loss. The right treatment approach for you will depend on various factors, including the type and severity of your hair loss, your overall health, and your personal preferences. It's a journey that requires patience, persistence, and a willingness to explore different options to find what works best for you. Don't be afraid to ask questions, seek second opinions, and advocate for your needs throughout the process. Remember, you're not alone in this. Numerous resources, support groups, and online communities are dedicated to helping individuals navigate their hair loss journey. Section 11. Hope for the future, living with hair loss. While hair loss can be a challenging experience, it's essential to remember that it doesn't define you. Embrace self-acceptance and focus on the things that make you feel confident and beautiful. Experiment with different hairstyles, hats, or scarves to find what makes you feel your best. Remember that beauty comes in all forms, and your worth extends far beyond your physical appearance. With advancements in medical treatments and a growing awareness of hair loss, there's hope for the future. Scientists and researchers are constantly exploring new and innovative approaches to address hair loss, bringing us closer to effective solutions. In the meantime, focus on living a healthy, fulfilling life, and remember that you're not alone in this journey.